Let's talk about falling accident. Among the causes of this fall, lack of muscle strength is the main cause. This fall can also lead to complications. For example, if you have a fall fracture and you get walking disability, you will have less activity. So this will lead to decreased muscles and less heart and lung function. In addition, the injured person may suffer psychological constriction and be restricted from social activities. Blind people are prone to fall due to limited visibility. If you fall, you can not only have bruises but also fracture and even death. Prevention is the most important thing for this misfortune and falls. But there's not enough prevention for people who are blind. How can we help them?
Hi guys, we are students at University of Seoul, majoring in sports science, and we are participating in advanced adaptive physical activity. Making assessment tool for persons with disabilities is our assignment. So we make assessment tool by using Jumprope for person who is blind to prevent from falling. This is our assessment tool. The reason why we created a measurement assessment using these curves is that we can prevent falls and live-in accidents by 80% with ankle and calf muscles. But this was no tools to assess the real ability and the complex ability of curves associated with the prevention of falls for a person who is blind. So we adopted this assessment tool.
There are 4 criteria for this assessment. There are distance, frequency, area of footpad that touches the ground, and the failure point, each with a score of 1 to 5. First, the distance measures how far away you are from the square box. The less distance you go, the higher the score. One second. Here's the frequency. The more you do in a given minute, the higher the score. The larger the area of the footpad you touch the ground, the smaller score. For example, using only toes gets 5 points. Bending knees too much with whole footpads gets 1 point.
Okay.
Okay. Go.
Lastly, the failure point measures how many times it fails to perform a jumping rope. And the more times it fails, the lower the score.
내가 못하는 거잖아. 다른 다
In conclusion, according to this criteria, the person who scored 20 to 18 points need to remain in the current state. 17 to 16 points are good, but more effort is needed. 15 to 12 points are normal, but have some risk factors for falls. 11 to 8 means that additional exercise is needed for strengthening calf muscles. People with 7 to 4 points are in very bad condition and need to exercise steadily. That's all for our video. Thanks for watching.